Overnight, 39 new cases of COVID-19 were reported in Arlington County, bringing the 7-day trailing total to 198. This is the first time since June 2nd that the average rate of new coronavirus cases has been this high.
Good afternoon, everyone.
During a virtual news conference today with the Arlington County Board, Public Health Director Reuben Varghese addressed the frustration people have shared about seeing an increase in cases and explains how this could be our new normal.
Yeah, we did have that peak in the curve, and then middle June was when the cases went probably the furthest down, and that was at the end of the governor's executive orders for the stay-at-home orders. Obviously, you can see the curve was being flattened. What you can see here is that as we've allowed more people to congregate under the governor's executive orders to 250 people at most or less, we've seen more a rise in cases. That doesn't mean we have hit a spike. This may be our flattened curve.
So what is the county doing to continue flattening the curve?
We, of course, then isolate infected people, and we provide social, economic, and emotional support for the cases, and trace and quarantine contacts, and also provide social, economic, and emotional support for those cases.
In Arlington County, the Hispanic population is almost 16% of the total population, yet they account for more than 41% of the county's total coronavirus cases. Dr. Varghese says that by committing to a plan that aims to flatten the curve and not eliminate infection altogether, it assumes we're prepared to live with a certain level of the virus in our community, and it's up to the community to decide what that is.
Once you flatten the curve to whatever level is acceptable by the community, you're making decisions about the trade-offs with other priorities.
One of those trade-offs is distance learning. And while the decision to reopen schools rests in the hands of the school board, not the county board, the county says they've allocated $12 million in funding to make sure that Arlington County Public Schools are financially supported to resume in-person learning when they're ready.
About $10 million of that from CARES money, and more money from other sources to pay for critical needs, to not only support students who are out of school, like that extensive internet connectivity program, but also on things like personal protective equipment and public health staffing and other pandemic-related services.
I want to be very clear that if APS were to decide to open schools, we believe that we've provided the resources necessary for them to do that.
Arlington County Public Schools are considering a plan to start hybrid learning. In that plan, the students of working parents would receive supervised learning in community centers. What I found interesting is that the public health director says the group that he's most concerned about transmitting and spreading this disease is adults to adults, not kids.